Dr. Lizi. Very nice to meet you. How can I help you? Okay, you want me to check your cranial nerves? Okay, what do you think is wrong with your cranial nerves? Oh, okay, well, let's look then. Let's have a look. I'm so sorry, what is your name? Yeah, that's a very sweet name. Well, can you describe me when last time you had a headache? Look at my nose, please. Okay, and do you remember for how long it lasted? Okay. Can you look at my nose? And with your peripheral vision, can you see how many fingers I show you? Okay, look at my nose. And with your right peripheral vision, do you see how many fingers? Okay, please look at my nose. And with your left peripheral vision, do you see how many fingers I show you? Okay, look at my nose, please. And with your right peripheral vision, do you see how many fingers I show you? Okay, now I'll ask you not to move your head. Okay, look at my nose. Keep looking at my nose. Okay. Can you look at my finger? Follow my finger, please. Follow my finger. Okay. Look at my finger. Look at my finger. My finger. My finger. My finger. Okay, I'm going to close your right eye, and with your left eye, can you follow my finger, please? Okay, I'm going to close your left eye with your right eye. Can you look at my finger? Can you tell me when you see my finger moves? Okay. Yeah. Okay, let's do that. Okay. Look at my nose. My nose. My nose. Okay. Can you open your mouth, please? Okay. So, what can you tell me about your sense of smell, taste? Okay. I'm going to have to look close to your eye if you don't mind, okay? At the same time, can you please focus on my finger right there? Exactly, right there. Right there. Okay. Look at my finger right there. Right there. Okay. Right there. Okay, just look straight. I'm going to swing the light. Just like that. Okay. Okay, I'd like you to look at my hammer, please. Try not to move your head. Focus on the hammer. On the hammer. On the hammer. Okay, hammer will come closer. You look right here for me. And we'll go back. Come closer and we'll go back. You're doing great. Okay, are you having a headache right now? Are you having a headache right now? Okay, that would be nice if you can describe how do you feel right now. I would like to check your cornea if you don't mind, okay? I'll put a pretty bright light, but try not to look at the light if you can. For example, you can focus on the finger right there, or you can look at any picture on the wall you see right there. Try not to look at the light. Okay, you're doing great. Okay, I'll ask you to follow my finger. Keep looking at my finger. Okay, look at my finger. Okay, I'll ask you to look at the lamp right there for me. Focus on that lamp. Thank you. Okay. Okay, now look at that lamp right there. Okay. Are you having any problems with your vision? For example, after spending so much time on the phone or on the computer, are you having a hard time focusing? Okay. I'll ask you to look up for me, please. Look up. Thank you. Okay, look to the right side. Oh, that's fine. Okay, now look to the left, please. Nope. Okay. Now look right and left slowly. Move your eyes to the right and to the left. At some point I'll have to tell you stop, okay? Just keep looking to the right, to the left, to the right, to the left. Okay, great. To the right, to the left. Stop now. Okay. Ooh, that's a lot. I'm sorry about that. Okay. Ask you to take a deep breath with your nose. In and out. In and out. In and out. Okay, now take a deep breath with your mouth. In and out. You're doing great. In and out. In and out. Okay. I would like to examine the muscles on your face. Okay. I'm just gonna give a little pressure on the muscles. Okay, are you having trouble sleeping? For example, how many hours do you sleep a day? A night, I'm sorry. But maybe you're lucky. Maybe you can sleep at daytime too. Okay. I understand. Can I ask you to raise your eyebrows and hold your eyebrows there? Okay. Can poke your cheeks out. Hold it. That face, please. Thank you. Okay, open your mouth and I'll try to close it, but don't let me do that, okay? Okay, now you can close your mouth. I'll give a little pressure right here. Okay, it might stink a bit, but very, very little. I'm sorry about that. Okay, that's great. Can you tell me if you can see the stick? Can you tell me the color of it? Okay, so I want you to look at the highest point of the stick, and I'll close your right eye. Okay, and with your left eye, just follow the stick. Okay, can you please tell me when the stick disappears from your vision? And when it appears in your vision? Okay. Okay. So here's the same thing. You tell me when it disappears from your vision and when it appears in your vision. Just like that. Okay. 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 Now I want you to look at my nose, please. Focus on my nose. Whenever you see a stick appears in your vision, I want you to let me know, okay? Okay, now keep looking at my nose, please. You're doing great. Please let me know whenever you see a stick disappears from your vision. Let's try it again. I interrupted you, I'm so sorry. Okay, whenever you see a stick disappears in your vision. That's right, and when it disappears. Okay, now I want you to close your right eye. Here we go. With your left eye. Look at the stick whenever it disappears. Okay. Now with your right eye. Whenever it disappears, you let me know, okay? Okay. With your left eye, whenever it appears in your vision, you let me know, okay? Okay. And with your right eye, whenever it appears in your vision, you let me know, okay? Okay. I'm going to show you some charts would be correct. There will be a few of them, so I want you to look at this chart for me, please. Okay. Can you tell me letter? Can you see letter right here? Okay. What about this one? Okay. This one. What about this one? What about this one? Okay. Yep. Okay. Okay. Can you read this one? Well, that's great. What about this one? Okay. And what about this one? Okay. I will ask you to close your right eye for me. Let's see if you can see letter right here. Can you see this letter right here? Okay, what about this one? Okay, what about this one? A little bit hard to see. Okay, what about this one? Little blur, I understand. What about this one? Okay, with your left eye, please. I'm sorry, with your right eye. Okay. Can you see this letter right here? Okay, right here. And right here. Okay. What about your both eyes? Can you tell me if you can see letter right here? Right there. This one right here. Okay. What about this one? Right here. Okay. Can you read me this line? Okay. Well, can you be able to see this one right here? Next one. Next one. Next one. Next one. Okay. I will give you a moment, okay? Well, now I would like to examine your hearing. So, do you think you have any problem with your hearing? Okay. So I have a tool here. One corner of that tool is pretty soft. It's like a little microphone. Exactly. And one is also like a little microphone, but it's pretty hard. Okay. So So I want you to be able, if you be able to recognize the texture. Okay. Okay, you got me. Okay. Do you feel this? Soft. What about now? Okay. What about now? Okay, if I do that, and if I do that. Okay, now I want you to focus on the sound you're going to hear. Okay? Tell me if you can hear any difference between your right and your left. Okay, well, now I will whisper something to your ear. Okay, and I want you to repeat it. Number 8. Okay. Number 6. Number 12. Am I speaking too loud? Okay. Number 6. Okay. Number 28. Number 85. Well, okay, you did a great job. But anyway, I'm going to grab the scope and check, okay? Okay, I want you to look right here for me. Can you tell me the color of it? Red. Okay, I want you to look at the red thing. Okay, no matter what. Look right here. I'll ask you to look at the light for me. Okay, look at the light. I'm going to close your right eye. You keep it open. I'll close it with my hand, okay? tell me the color you see? Okay. The color you see? The color you see? Okay. The color you see? The color you see? Okay. I would like to examine your sense of taste. Is there a sense of taste or just taste? One more time. Okay, so you said you had no problem with your taste, right? I'm going to give you something. Okay, and you will tell me what does this taste like. Okay. Okay. That smells good. That's very, very close. Oh, I'm sorry, am I giving it too fast? Yeah. I'm so sorry. That's exactly. Bravo. We have two more. Here we go. Which one to go? Let's see if you can recognize this one. That's nice. Okay, do you have any problem with your sense of smell? Okay, well, I'm gonna give you to smell this. Okay, what about this one? It's okay, you can take your time. What about this one? Okay. What about this one? Okay. Well, I think you did great. Okay, I would like to examine your sensitivity on your face. I'll put my two fingers right here. Okay. Do you feel that? Okay. I want you to relax your face, please. Okay. Okay. If you don't mind, I would like to check your ears one more time. doing some in your hearing test. Your hearing, not the test. I'm doing test. Oh my god, I can't. Okay, let's examine your hearing. Do you hear that? Okay, can you tell me on which side the sound's coming from? From which side? Okay, what about now? Do not cheat, don't look there. Okay, can you tell me the direction now you hear? Okay. Whenever you hear the direction of sounds change, I want you to let me know, okay? Okay. What about now? Okay, I'm gonna go behind you and you'll hear the sound. I want you to tell me basically the same thing. Okay. Do you hear that? Okay. Okay, can you tell me the direction where you're coming from? What about now? Very close. Very nice. Okay. Do you hear the sound moving all around? Okay. Would you be able to tell me when it stops? Nice. Let's try again. Okay. Sound will change to something like this. Okay. I want you to do the same thing. Whenever you hear sound stops. Whenever you hear sound stops, you tell me. Okay. 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 Well, now you'll hear something like this. Okay. Whenever it stops, you tell me, okay? Very nice. Okay. Yeah. Okay. That's nice. Okay. That's very nice. Okay, I'll point this to your eye and I want you to look right in the middle, okay? Look right in the middle. I'm going to show you a few cards. Let's see if you'll be able to tell me. I'm sure you'll be able to tell me. Let's see. Okay, I better just show. Okay, look right here for me. What do you see? Okay. Can you tell me the colors you see on this one? Okay. Yep. What do you see here? Okay. And can you tell me the colors on this one? Okay. Okay. I think you need a little bit more rest. Okay? Because everything is perfectly fine with your cranial nerves. Well, lately, it's been a long time since something been wrong with the cranial nerves. So, I want you to stay at home, rest, no phones, no computers. Well, maybe YouTube for a little bit. Well, that's it. This is for you. Here you go. You're very welcome. You're perfectly fine. Just need a little bit of rest, as I said.